Hi, I'm Caleb with Cell Scale Biomaterials Testing, and today I'm talking with Pete Hammer at the Boston Children's Hospital. It's been good talking with you, Pete, and you have a really interesting position. You're an engineer, but you work at a hospital with the surgeons. Can you tell us a little bit more about what that is like for you and what your purpose or can you tell us a little bit more about what your role is here?
Yeah, you're right. It's a bit of an unusual arrangement.
Speak up. I don't know how the camera's going to pick this up. There's a bit of background noise.
Yeah, you're right, Caleb. It's a bit of an unusual arrangement having an engineer working in a department in a hospital. I've been working in research for many years, and then several years ago was hired by the department to work directly with the clinicians, primarily cardiac surgeons, to help bring some quantitative methods to bear on some of the most challenging problems in cardiac surgery.
And what type of problems have you been tackling with regard to helping the surgeons do a better job with the surgery?
Up until now, mostly heart valves, helping to understand the biomechanics of heart valves, but in a sort of clinically relevant way. In other words, if the surgeons are faced with a reconstruction of a heart valve, a child's heart valve, helping them understand what ways they can sort of measure and quantify the elements that go into a valve reconstruction to get them a reliable result.
Yeah, you were telling me earlier how often the valves are taken from the patient's own pericardium material, and so you're trying to help them do a better job of harvesting that tissue and understanding how best to use the tissue that they have available.
Yeah, that's right. In children, they typically will try to repair a valve rather than replace it. And repairing it means cutting and sewing either the tissues that are already there in the child's valve or introducing materials, preferably the child's own materials, such as pericardium, to reconstruct a leaflet or even all the leaflets of a valve to get a working valve. And the challenge is that those materials, the properties of those replacement leaflet materials, such as the child's own pericardium, are not the same as the native valve leaflet. So the surgeon's got to make some alterations to the way he would size and shape a patch or a replacement leaflet. And to do that, he really needs to know the properties of that in a quantitative way.
And so your research was to do mechanical testing, not for the purposes of material modeling or generation of synthetic materials, but just to provide that feedback to surgeons directly to see that impact right away.
That's right, to help them understand if I use this type of material, which is very stretchy, medium stretchy, not stretchy at all, depending where it falls on that stretchiness spectrum, how do we compensate when cutting and sizing patches and replacement leaflets to result in a repair that's robust and durable. Yeah.
And what was the workflow of the research then? You had to do mechanical testing, so you needed samples, and you had that good communication with the surgeons. So how did you get samples? What type of samples were they, and what type of results were you able to get from the surgeon?
Yeah, so when a surgeon's going to operate on a heart valve and knows that they may need patch materials, they will harvest some of the patient's own pericardium, put it aside, typically fix it to stabilize it using some type of chemical fixative like fluoraldehyde. And then during the procedure, we'll then cut a patch out of this mucus during the procedure. They typically don't use all of the patch that they cut out, and it just goes into the trash. So I simply used discarded operating room tissues, harvested those, retrieved those, and then we're able to test those in the lab here to build sort of a library of the properties of these different patch materials, treated for different amounts of time or harvested from different sites.
Yeah, you mentioned you were able to compare it, as you said, to different fixation times or treatment times to determine how extensible it is, and also compare it to other commercially available products, and do some studies with the alignment of the tissue, the orientation of the tissue. And then how is that fed back to the surgeons? I guess through communication and other types of means that you have to publish this work and share this work?
Yeah, first I can start by saying that there really are not standard techniques for harvesting and fixing these tissues. Every surgeon does it a little bit differently. So part of the goal was to sort of to put numbers on these the different variables that are involved in this process. How long do they fix these tissues? How much are they stretched when they're being fixed? And also the harvest site of the pericardium. How does that affect the properties? how it behaves. So part of the problem was, part of the challenge was really to try to quantify all the different steps in this that affect the final result, which is the stretchiness and the durability of these patches. In terms of disseminating this information, after we collected a fairly large number of samples from a lot of different fixation methods, we wrote this up in a journal article and submitted this to a journal, not an engineering journal, but a journal that the surgeons read. And that was a bit of a challenge, taking this material that normally these methods and approaches that are used typically in engineering fields and distilling it and relating it in a way that the surgeons could understand. They could then apply it in their own practice. So keeping it very practical.
We're certainly glad you're doing these kind of things, and it's nice to see such a direct application of the knowledge that you're getting from equipment like the biotester towards health outcomes in the very short term.
Yeah.
I think I hope there's more roles like yours that are continuing to come into existence in the world, and more close interactions with engineering and material science people and surgeons. I think we are starting to see more and more of that. I think it's a very good thing. So
yeah,
well done. Good for you.
Thank you. Yeah, it's meaningful work, and it's also, I'm also we're happy to see the machine like this come along that really took the mechanical testing apparatus from every lab having their own home build system to something that could really take a lot of the nuts and bolts assembly and machining and software control work out of it, and just make that all a turnkey type capability. So this has been a real asset to this type of a lab.
I'm glad you're in capable hands and you're doing good work. Thank you very much. Thanks for talking with us. I appreciate it.
You're welcome.